Okay, welcome everyone. My name is Katie Glass and I'm the Associate Director Education for Population Health at ANU. I'd like to start by acknowledging the traditional owners of the land on which we meet today. For me, that's the Ngunnawal and the Ngambri people, and pay my respects to elders past, present and emerging.
Okay, hello everybody and welcome to our session on public health at the ANU. I'm going to talk a bit about our Masters of Public Health program today. So my name's Dr. Matthew Kelly. I convene the Masters of Public Health program at the ANU. I also lecture into some of the courses, concentrating on global health and public health surveillance. And I'm an international health expert, and I do a lot of research on health in the Asia Pacific region. So just a bit of an overview of what I'm going to talk about today. I'm going to talk a bit about what public health is. I know not everyone is so clear on what the discipline actually involves. We'll talk about different areas of public health and their applications. Then we'll talk a bit about jobs in public health. What can you do with a public health degree? Then I'll talk a bit about the educational offerings in public health at the ANU, and then a little bit about what people have done with their degrees afterwards. So firstly, a little definition. What is public health? When we think of health in general, we tend to think of doctors treating patients and hospital care and clinics. But public health is looking at health at a broader level than that. We're looking at the health of whole populations and what affects the health of whole populations. So, you go to see a GP or a doctor and they give you medicine and treat you. But in public health, we try to implement programs that will affect the health of everybody in the society. The WHO defines public health as aiming to provide the maximum benefit for the largest number of people, and I think that fits well with what I just said. So historically, public health interventions have been around for a long time. Some of the earliest public health programs are around sanitation and hygiene, when people discovered that clean water supplies were beneficial to the health of the population. Later, in England, even in the 1800s, some of the biggest public health problems, such as cholera, were solved by implementing clean water regulations. Moving further a little, vaccination is possibly one of the most powerful public health interventions that has been developed. Vaccination has saved the lives of billions of children and people around the world, and has even allowed some major health burdens to actually be eliminated, such as smallpox, and to be nearly eliminated, such as polio. In the modern era, we often look at public health approaches through policy interventions. We know that tobacco smoking causes a large proportion of the health burden in most countries around the world. So public health people, yes, we talk to individuals and try to convince them to quit smoking, but at a public health or a population health level, we try to use policies such as taxation to make cigarettes more expensive, to make it more likely that people will quit or that young people will not take it up. We also severely limit where people can smoke now. So people can't smoke in public places, in workplaces and so on. And these are efforts to change population levels of smoking. Similarly, for obesity, to try to get an individual to lose weight is one approach. But when we look at obesity at the population level, we're talking about things like nutrition labeling to enable the population to make different food choices. Also sugar taxes and fat taxes to make the relative pricing of foods, to make healthier foods relatively more affordable. These are all modern public health interventions. So public health, I like to say, is one of the broadest disciplines out there. We need people from every different discipline to successfully intervene in the public health of our population. There is statistical analysis, there is economics, environmental sciences are important. The environment affects our health so directly. Social sciences are needed to understand how a public health program can be most effective. We have to understand the culture and the society in which that public health program is being implemented. Demography, we need to understand the populations upon whom public health interventions are going to be enacted. So what does public health research involve? What do we actually want to know when we're doing public health research? So the first point is to measure the burden of particular diseases in populations. So we want to know how many people in a country have a particular disease. The second point here is very important. We need to know who in that population has that disease, how diseases or health states are distributed by sex, by age, by social class. All of these things are very important. Then we need to know what are the risk factors, what is causing these disease burdens. That then allows us to design some of the public health interventions I've been talking about in the earlier slides. And finally, we need to assess how effective the public health interventions have been, which takes us in a circle back to seeing if the burden of that health condition has reduced in the population. So where do public health professionals work? Well, academic research is one area, academic research and teaching, where I work, but also people work in public health departments of local, state and federal governments and international organisations, of course, such as the World Health Organization. Public health nurses or physicians work in hospitals and health facilities. Health promoters work in all sorts of areas. Urban planning needs public health people even. Public health is a very broad discipline. So again, public health professionals come from a wide range of academic disciplines. So people come into studying public health, as I discussed earlier, from a mathematics background or a science background or a demography background or a social science background. All of these undergraduate degrees can then place you well to pursue postgraduate studies in public health. So I work at population health at the ANU. And within our school, we have some of our aims here. We're an interdisciplinary school. We have a strong social science workforce in our school. We have statisticians, mathematicians. So people wanting to come into our school to study, to do a Masters of Public Health, to do a PhD, will find some discipline within our school that will be rewarding for them. We have an international focus. We focus on the Asia Pacific region particularly, and we strive to improve the population's mental and physical health. These are some of the areas of expertise in our school. Epidemiology, of course, and biostatistics. We have a very strong contingent who work in field epidemiology, who are busy working on the COVID-19 response, informing government, working with contact tracing, helping to develop the best response. But also we have all these other areas of expertise within our school. These are some of our current research strengths in the school. We have a strong focus on the health of Indigenous Australians. We have a strong focus on health and tropical diseases in Asia. Also ageing and health, mental health, a whole range of research is going on in our school. And finally, I'll start to talk a little bit about our Masters of Public Health program, which I am the convener for. So we run a 2-year Masters of Public Health program at the ANU. If you've completed a previous degree in a cognate discipline, we can shorten the degree to 1.5 years. We have 2 versions of the Masters of Public Health. One is 2 years of coursework. The other, which we refer to as the MPH Advanced, involves 1.5 years of coursework and then a 1-semester research project. Of course, the degree can be done part-time over longer periods as well. We pride ourselves on having research-led teaching. None of our MPH teaching staff are purely lecturers. All of them are researchers and experts in their field as well. So all of the teaching that we do in our MPH is informed by the latest research. Our MPH is available for study online. It is possible to do our MPH fully online or as a mix of face-to-face and online, depending on your circumstances. So the MPH is designed for health professionals. It is a professional degree. It will qualify you to work as a public health professional. or a health administrator or a policy working in public health policy. I talked about some of the areas that people work before, government departments and so on. The MPH is the right degree to lead you into that sort of workforce. People who do the MPH advanced degree also sometimes choose to then continue and do a PhD and work in academia as a researcher or a lecturer. This is also an opportunity that the MPH can lead into for you. So just briefly, as I said before, a lot of our staff in our school are involved in the COVID-19 response, and that's been a very strong outcome for our school. A lot of our MPH students have even been immediately involved in response with contact tracing and so on. And a lot of our research staff are hands-on in public health surveillance for COVID-19. And this is, you can learn a lot more about that through coming and doing an MPH in our school. So I'll finish up there. Thank you very much for listening and attending this talk. And I hope that you will consider studying an MPH with us at ANU in the future. Thank you.
Well, I graduated last year from my undergrad in the Bachelor of Science, and I knew that straight away I wanted to do a master's program, or at least further studies. In my undergrad, I was doing like I majored in human biology, and I'm specialised in biomedical sciences. So I knew I wanted something adjacent to the health field, but not exactly very science-based as I did in my undergrad. So I thought, like, I was looking through the master's programs at ANU, and I definitely thought that public health was a really good way to explore health in a different way that I didn't really explore in my undergrad. Well, I think due to the nature of the degree, it really allows you to tailor different aspects of health that you might be interested in going into. So when I first started, I was thinking more like clinical epidemiology, but now that I've gone more into it, and also as I'm considering my research and through some of the work that I'm doing, I'm thinking perhaps I want to go into more data analytics. So through that, I've actually been able to get a job at a data and health reporting agency, and I'm currently taking the analysis of public health data course, so that will definitely help out with that, and as well as my research will help out with that as well. So I think the masters can allow you to tailor your needs and in whichever way you want your career to go, really. Honestly, I like the assignments. They're really great because I think they allow you to tailor whatever you want to do in the assignment. So it will just give you like a broad topic that you need to study or look into, and then you have the autonomy to choose how you want to take that. So which countries you want to compare, or I know for one of the like mental health courses that I'm doing right now, one of the big assignments is choosing a issue in mental health and writing like a whole 3,000 word like essay on that. So that really allows you to explore whatever you want to do and get into what you're actually interested in. Yeah, so I think that's my favorite part about it. Well, first of all, definitely look on the ANU programs and courses page. Look at that, look at the subjects that are involved, see which ones you want to do, and I guess think about how you might want to tailor your degree. As well as that, I definitely recommend they talk to you, the course convener. I think you were really helpful when I was considering doing the masters and helped me map out my degree a bit. So that was quite helpful as well. I'd also urge them to consider whether or not they want to do the research pathway. I know initially I wasn't really considering doing research, but then I ultimately did decide to go down that path. And I think adding the research component to my degree has really opened up a number of different career opportunities for me. So I'm personally glad that I chose to do that. So yeah, just consider their options is what I would say. I think the way the course was originally structured, even prior to the pandemic, was really great in the sense that it was quite tailored to people who might be working full time or just, couldn't commit to having to come into uni every single day. So I think all of the courses in the master's program were available online anyway. So, so in terms of the study aspect of it, I think not too much has been negatively impacted, and I think things have honestly been able to run quite smoothly despite the pandemic. In terms of the work that I personally do, I think the Masters of Public Health has actually aided quite a bit, obviously because the pandemic is a public health crisis, and well, that's what this Masters is, it's a Masters of Public Health. So it's aided me actually quite a bit in actually getting 2 job opportunities from this degree and what I'm doing now. So yeah, it's been pretty beneficial to me, honestly. I actually got into that, I guess, because I was doing the MPH. Some of the officials at the ACT Health, they contacted MPH students and asked us to, do a contact tracing course. Initially it was volunteer work, and then obviously the pandemic got a bit out of hand. So it's turned into like a real job, and it's still going on even today. I think the fact that I was doing the Masters really did poise me in a sort of perfect position to be able to help out in that crisis. And honestly, I couldn't be like more thankful to have that opportunity, just because the work that I do there is obviously beneficial to the community, but I really honestly do find it so rewarding. Like every time I go home from work, I always feel really light and happy that I've just been able to help out and talk to the people and really get like a first-hand experience of how different people are coping with the pandemic. And I think it helps with other aspects of like healthcare after the pandemic, because you'll see what this really does to people. You see the like mental health deterioration, you'll see how they're coping with it, financial struggles, all of those different aspects of it. And then you can apply all of that knowledge and also the empathy that you feel towards those people, you can apply that into other aspects of healthcare. And like if you want to go into, for me, like data analytics, I think it makes me more pedantic and meticulous with my work, because I've talked to the people that I'm reporting on. I know why what I'm doing is really important, and it really makes me like really focus and think like I need to get this right because I need to represent these people properly. So yeah, I think it really has allowed me at least to, I guess, expand my knowledge and gain a lot of empathy. Yeah, I would say definitely keep your eyes peeled for opportunities, because they do actually come quite a bit. You just need to make sure to capitalize on them. So yeah, definitely check your emails quite a bit. But also take full advantage of being at ANU. Don't just come here just for the degree. I mean, whilst that's very great to do that as well, I think do try and get as involved as possible. I know personally I'm really passionate about volunteering, so I made sure to, join the volunteering society, and I've been able to plan a lot of events through that as well. So yeah, find what you're interested in and make sure to make the most of your time, not only like doing the master's program, but also just being at ANU in general. Yeah.
I'm Ben Polkinghorn, Program Convener of the Master of Philosophy in Applied Epidemiology, commonly known as the MAE program. So what is the MAE program? Well, we're Australia's internationally accredited field epidemiology program, an intensive 2-year training program that emphasises learning at work, from work and for work. And the MAE program is a founding member of the training programs in epidemiology and public health interventions network, TEFINET, which is the international peak body for field epidemiology training programs. And we're also a partner of the Global Outbreak Alert and Response Network, GOAN, which is based in the World Health Organization. So taking a step back, what is epidemiology? Well, we say that epidemiology is the study of the distribution and determinants of disease and health in human population, or the 3 Ds. So what is field epidemiology? Well, that's the application of the 3 Ds where the timing is unexpected, an urgent response is required. The epidemiologist may have to travel to the field to investigate, so-called field work, The scope of the investigation might be limited by timing, and quite often, and particularly in a pandemic, immediate solutions are required. So how does the MAE program work? Scholars learn field epi in the field through coursework and working in a field placement. Coursework is delivered in intensive blocks at ANU, but scholars spend most of their time in field placement, such as a health department in state or territory or federal, or a public health non-government organisation or research facility. Through the course of the program, the scholars have to investigate an acute public health problem or threat, usually a communicable disease outbreak, but not exclusively. They need to establish or evaluate a public health information system, such as a surveillance system, and they need to design and conduct their own epidemiological study. Alongside those major competencies, there are several sub-competencies. Scholars need to design and draft a scientific manuscript for publication. They need to present at a national or international public health conference. They need to complete a literature review for at least one of their projects and develop an explanation of one of their projects for a lay audience. And they need to teach their peers epidemiological concepts. And throughout the entire process, they need to synthesize all of those competencies into an applied epidemiology research thesis. So key facts for the MAE program: we were established back in 1991. So in 2021, we'll be celebrating 30 years. And for all of that time, the MAE program has been hosted by the National Centre for Epidemiology and Population Health, which is now in the Research School of Population Health. And over that 29-year period, we've had 240 graduates to date. And of those, 70% have been female and 15% have been of Aboriginal and or Torres Strait Islander heritage. So how can you join the MAE program? Well, we have one intake of approximately 15 scholars each year. Applications open in July for entry in the following February. The prerequisites for the degree are a bachelor's degree with 2A honours, or a graduate diploma or a master's with a significant thesis component. And highly desirable is at least 2 years experience in public health or related health industry. And we expect a working knowledge of epidemiology and biostatistics. Australian field placements are based around the country, but the numbers and the geographic distribution vary each year. For the 2019, 20 and 2021 field placements, we have 7 in the ACT, 4 in Victoria, 5 in New South Wales, 1 in South Australia, 2 in Western Australia, 2 in the Northern Territory, and 2 in Queensland. So the MAE program is an integral component of the COVID-19 public health response. The aim of the MAE program is to build a highly skilled EPI workforce and strengthen the capacity to prepare, protect, and respond to health threats in Australia and in our region. So MAE scholars are on the front line of the response. We have several who have deployed from their field placements to work in COVID-19 units specifically. Our MAEs have been investigating community clusters and cruise ship clusters. They've conducted analysis of pre-existing comorbidities and vulnerable groups. They've designed and evaluated COVID-19 surveillance systems, and they've done a lot of case management and contact tracing. So what happens after the MAE? What careers are available? Well, we're currently running an MAE alumni survey at the moment, but the results from the last MAE alumni survey in 2018 showed that the first job following the MAE for 31% of our graduates was working as an epidemiologist in a local, state, territory, or federal health department. 26% went on immediately to research or academia. 15% took on jobs internationally at the World Health Organization or NGOs, and that includes some volunteer work. And 14% worked in population health or surveillance, and surveillance and epidemiological jobs are really closely intertwined. and the remainder were other. So where can you find out more? You can hit up our website or you can email us. Thank you.